Hi everyone, it's Jasmine, and in today's video we are going to be chatting about sun safety and skin health. So I hope you learned something today, and let's get started. So why does sun safety matter? The sun emits ultraviolet, UV, radiation that can damage your skin. Too much sun exposure increases your risk of sunburn, premature aging, and skin cancer. For this reason, practicing sun safety helps to keep our skin healthy and lowers long-term risks. I think it's also important to note that our skin is our largest organ on our bodies, and it serves as a barrier to keep any bacteria, any harmful pollutants, anything like that outside of our bodies rather than being absorbed into our bodies. So keeping our skin healthy and strong is of extreme importance. Now, there are two main types of UV rays that affect your skin. UVA causes aging, wrinkles, and long-term skin damage, and UVB causes sunburn and plays a key role in skin cancer. Both types can harm your skin significantly, even if you're going out on cloudy days. Short-term effects of sun damage again include sunburn, redness, and irritation, but the long-term effects include wrinkles, dark spots, loss of elasticity, and cancer risk. Damage builds over time, even without visible burns. So if you're going into the sun unprotected and you think it's fine because you don't come back and have a red stinging sunburn, that is not necessarily true at all. We each can be affected quite significantly by sun damage. Now, I've mentioned skin cancer a few times now, but what truly is it? Skin cancer is actually the most common type of cancer, and there are three types within skin cancer. So there's basal cell carcinoma, squamous cell carcinoma, and melanoma, which is the most serious form of skin cancer. Early detection greatly improves outcomes, and we're going to talk in a little bit about things we can do to make sure that we are preventing skin cancer, and we are making sure we are getting checked thoroughly for any unusual looking spots on our skin to make sure it doesn't develop into cancers. Now, we're likely all quite familiar with the daily sun protection tips, but wearing sunscreen with SPF 30 or higher, ideally even 50, because I feel like as we all are experiencing, our summers are getting hotter and hotter and the sun is out for longer, so just having that extra protection can help. Seeking shade, especially between the peak sunny hours, 10 a.m. to 4 p.m. Wearing hats, sunglasses, and protective clothing if you can't necessarily be in the shade all the time. Having a hat to block your face, sunglasses to protect your eyes and retinas, and so on. And then we want to avoid tanning beds, which emit really high artificial UV rays that can be extremely damaging to our skin integrity. Now, we've all heard that we need to be putting sunscreen on every day and use your SPF daily, but how do you use sunscreen actually properly? To use it properly and to get the most effective use out of sunscreen, you want to be applying it 15 to 30 minutes before going out into the sun. You want to make sure you're also using enough to cover all of your exposed skin. This ends up being honestly about a couple tablespoons or even 1 to 2 tablespoons of sunscreen, as a little can actually go a long way, and you'll notice that when you scrub it into your skin. You want to make sure that if you are outside being active, you're sweating, or maybe you're in the water and you're swimming, that when you come out of those different activities, you are reapplying the sunscreen because it can wick off your skin. And you really don't want to forget little areas like the tips of your ears, your neck, your lips, and so on. I would also like to raise the point of making sure we are checking the expiration dates on our sunscreens. As with any product that holds active ingredients, they can expire, and making sure we're using the sunscreen within the expiration date is really important in making sure we're protecting our skin properly and not having any adverse reactions to the product. To make our skin strong and healthy, there are things that we can do beyond sun protection and beyond the surface level. So we can make sure we're staying hydrated. Hydrated cells can function a lot better than dehydrated cells. We also want to make sure we're eating a balanced diet that's rich in antioxidants. These antioxidants help our skin make sure we're keeping toxins on the outside and not coming into our bodies. We're avoiding smoking, and we're using gentle skincare products. The skincare market is extremely saturated these days, so making sure we just have simple products, and I'll show you a few here, that serve as a really gentle cleanser, moisturizer, and then a good sunscreen can go a long way in protecting our skin barrier, and we're not using products that have hundreds of ingredients that can be really irritating to the skin. Now, for example, Vanny Cream makes a really gentle facial cleanser and moisturizer and are on the more affordable end of the market. You can pick these up at a drugstore for less than $15 each, but they're clean ingredients and they're equally as effective as other cleansers and moisturizers in restoring our skin barrier. Then you may want to splurge and have to splurge a little bit more on a good sunscreen, but there are many, many available that dermatologists can recommend. Now, as promised earlier, let's chat about how we make sure that we're checking in on our skin and we are reporting and doing something about anything that looks a bit unusual. Now, best case scenario, you are booking a physician's appointment to go in to have your skin checked, but there are little things that we can monitor for on ourselves or on our loved ones day to day. First and foremost, we want to look for new moles or spots. So if you know that on your arm you did not have a mole and all of a sudden now you do, that can be a red flag. We want to monitor our freckles and moles as well to make sure if they are changing in size, in shape, or even color, that we are making sure we report these. If you ever need a second opinion, ask a family member. You can look these steps up. You can also, again, go to your family physician. Something else is if we have a sore that doesn't heal. So say we think that we acquired a wound on our leg from bumping it against a table, but you're recognizing that, you know what, this wound is taking an awful long time to heal. That might mean that something abnormal is going on beneath the surface. There is a general A, B, C, D, E rule that can help us remember things to look out for. So asymmetry, border of the moles and freckles, color, diameter, is it changing in size, and evolving, which relates to the changing in size or shape or color and so on. Now, what happens if we detect any of these things? We go to our general physician and we show them the freckle, mole, whatever it might be, and then they would likely do it themselves or refer you out to a dermatologist to have the spot removed and potentially for further testing to be done. So in all, sun safety is essential for preventing skin damage and cancer. We need to make sure we're protecting our skin daily and not just on sunny days, and this applies going into the winter months as well. Early detection and healthy habits make a big difference in our skin health, so just getting in a simple routine of adding some good SPF to your skincare can go a long, long way. Thanks for watching.